Welcome to Lunch and Law. I'm Jenin with NCLA, and I'm here to discuss vaccine passports with four distinguished panelists. Here with me in Washington, D.C. is Adam Creighton, former economics editor and current Washington correspondent for The Australian. And remotely from, I believe, California is professor of medicine at Stanford University, Bhattacharya, who's one of the co-founder or co-writers of the Great Barrington Declaration, a short treatise that advocated for focused protection of vulnerable populations rather than broad lockdowns. And we have Phil Magness, Director of Research and Education at the American Institute for Economic Research, a vocal opponent of lockdowns and mask mandates since the beginning. And Naomi Wolf, who might be going in and out a little bit, who's a writer and journalist, author of The Beauty Myth, and a fierce civil liberties advocate. So I want to start today by with the question, answering the question, what are vaccine passports? What do we mean by vaccine passports? Phil, you want to take a stab at it?
Yeah, I can take an attempt at that. So vaccine passports are both a public and private really advocated policy that have really kind of come into the mainstream discussion over the last few months, basically since the rollout of the vaccines. And the idea is that it's basically an implementation of a pass to access components of daily life that we used to take for granted before the pandemic. And that might be something as simple as booking a restaurant reservation or being able to eat indoors, to attending a sporting event at a stadium, to being able to get on an airplane. So it's the idea that you can be barred from regular commercial activities, regular venturing out into public if you do not produce and show a passport or a document saying that you have been vaccinated against COVID-19.
So a lot of people say this isn't really a legal issue, or it's not an issue of concern for civil libertarians because these are private businesses or enterprises who are implementing these programs. What would be your response to that?
Well, the first thing I'd say is that whenever you see a regulatory mechanism that's ostensibly coming out of the private sector, beware, because the impulse is always for the government to step in and either capture control of that mechanism or to nudge the so-called private regulator in a direction that corresponds with public policy. And we know this from all sorts of other areas of life. So I liken it to something like the airport security before the TSA. And if you think that the introduction of the TSA has made airports better and more secure and safer, in the wake of 9/11, that's a classic example of a government entity coming in and co-opting something that wasn't quite always public sector prior to that event. And I'd argue it's made it airports a lot more hectic, worse to travel through, and really hasn't done much to improve safety. Other examples we see throughout life, accreditation in higher education. It's nominally private, but the people that are really calling the shots are the Department of Education and the funders in Washington, D.C. And this has made higher education itself very subservient to bureaucracy and regulation, even if it isn't nominally on paper operating under a public mandate of that nature. So the risk is always there that the government's going to step in and take over or co-opt or capture any privately implemented system such as this. And I think this is very present in the situation of vaccine passports as well.
Adam, you want to?
Yeah, look, I think Phil makes some great points. I think the distinction between public and private vaccine passports or certificates is very important. I completely agree with him that when these things emanate from the government, it's far worse because they're far less likely to ever change in the future, regardless of what the risk is, because of bureaucracy and because of the incentives of government. But I'm kind of less concerned, although still opposed to private businesses or organisations of businesses having or insisting upon for a period of time some sort of vaccine, a certificate or something, if it makes people feel better. And so in that sense, I'd be opposed to the banning of these private initiatives, such as what's occurred in Florida or Texas. Even though I kind of agree vaccine passports are silly, I certainly don't think they're necessary. But they may be a way to calm down people who are very irrationally scared of a virus for a period of time. And then once the psychosis, once the hysteria subsides, which I expect it will, and I think it already is. And there have been all sorts of fads and manias through history. I think this is another one, and it will subside. Then people won't feel a need for these things, and they'll just fall away. But just to stress,
I don't know, the Delta variant.
yes, I know. Now there's a lambda variant. No, I've just read. But look, I really do hope it's not like airport security. I think that's a great analogy. I mean, the risk of terrorist attacks on planes is minuscule, so minuscule. It does not justify the massive intervention that we see at airports, but it makes people feel better, at least enough people feel better to fly. But I just hope that they're not perpetually scared of COVID, so they don't always feel as though we need these, this passport. But look, I mean, as long as the US doesn't introduce it, I mean, of course, I'm a foreigner, and I kind of look to the US. I think a lot of people look to the US to respect individual rights, and I think that's what's broadly happening across the US. Even the Biden administration, I understand, has said that they don't want anything to do with vaccine passports. As long as the US does not embrace it, I don't think it'll take off around the world.
Jay, did you want to?
I think this is a fantastic discussion. I think one of the points that's really relevant here is that the fear, in part, has been drummed up by the CDC. Yes. And by other government agencies. And in fact, in the UK, the SAGE had a behavioral commission that was explicitly tasked with drumming up panic and fear in the population about COVID. And so the fear is not just a rational response to the virus. It's a policy decision that's been made by governments around the world. So in that context, you have to think about the private demand for vaccine passports in that way. It's not just a sort of an endogenous, rational response to a threat. It's a panicked response to a problem that doesn't exist. I mean, if you're old and vaccinated, you're as protected as you're going to be from the virus in some sense. Whereas what does the vaccine passport accomplish? It says to someone, look, everyone around you is vaccinated if I go into this restaurant. Well, do you need that if you're vaccinated yourself? So I don't really understand the policy impetus behind it, other than the fear generated by, again, a policy response by the government.
And Naomi, you've been very concerned about civil liberties issues and governments drumming up fear to take people's civil liberties away. So we'd love to hear your perspective on this. If you can hear. Okay, maybe that's not going to work. Jay, I wanted to talk a little bit more with you. We had discussed yesterday, what the purpose of these mandates are exactly, and I thought you had some really interesting things to say about it.
Well, I mean, I think first question is, what does the vaccine do and what it doesn't it do? I think that we have to start with that to understand what the purpose, the public policy purpose of the vaccines might be. The vaccines are a fantastic tool for focus protection, in my view. The vaccines they're emergency use authorization, so they're not. We don't, like, people ask me what the long-term consequences of using the vaccines are. The answer is we don't know yet. We only have a few months experience with them, and they've been tested. They've been tested. They look like they're relatively safe, although there's some safety issues that have been identified. So to me, the question is one of balance of risks, right? So if you have a vaccine like this, if you are protecting against a severe risk, like, for instance, if you're older than 60 and you're vulnerable to COVID, I mean, you have a very relatively high rate of death if you were to get COVID. You compare that against the uncertain, it looks like it's pretty safe, but there's still some uncertain safety profile. It's still worth it because we know COVID is terrible for someone over 60. For a child, COVID is much, much, much less deadly. And you have this, it's just much less of a case you can make that it benefits the child from taking the vaccine. The other question about the vaccine is, does it stop the spread of the disease? And I think the answer is partly yes, but not entirely. And in particular, against the variants, we don't know that it stops the spread of the disease. It's not a tool, because of that fact, it's not a tool to bring the number of cases to zero. And if you have a vaccine passport, you enter a restaurant where everyone's vaccinated, that is no guarantee that you won't get COVID spread. that's just a fact about the vaccine. There's no guarantee in life in any case, but the vaccine, again, as I said, is incredibly powerful against reducing the risk of death and mortality from COVID and hospitalization from COVID if you were to take it. So it's more of a personal benefit than a public benefit. It's partly a public benefit, I think the largest and most important thing is it's a private benefit. In that context, the passports, again, what role do they serve? They don't serve the role that we normally think about as vaccines as, okay, we're going to stop the spread of the disease if sufficient number of people have it. I mean, it partly does that, but it doesn't entirely do that. If the goal of the passport is to reduce fear in people so that they're willing to enter a restaurant, I mean, I guess the question is, what's the root of that, and how does the vaccine address that? I think if you have an irrational fear about this, people are still wearing masks even after they've had the vaccine. It's not enough to address the fear by itself. So it doesn't serve that. I don't think it serves that purpose entirely. You address
also, from a legal perspective, a lot of constitutional rights, or several constitutional rights, are being trampled upon through these programs, because the right to assemble is certainly one of them. I mean, we're restricting that right. And normally you have to show, or you do have to show a compelling government interest in order to restrict fundamental rights in that way. So given the fact that it's not achieving what the government, is trying to claim that it achieves, it seems that it would fail that test.
I don't know. I've been so cynical about course. I've been involved in like 30 cases this year, and we've lost a crazy number of things where I thought we had these constitutional rights, and apparently judges won't defend it in the context of an epidemic. But maybe I hope you're right, Jenin. We get that that people come back to their senses and they say, look, these rights actually do matter.
Just on the legal rights point, it's really interesting comparing Australia, say, and other countries with the US, because although I take Jay's point, most judges have not kind of referred to the US Constitution to strike down various mandates. Some have, I believe, in Florida, and then there was a judge, I think, in Philadelphia. Whereas in countries like Australia, where our states essentially have no constitution, so parliaments can do whatever they want, as long as the law has been passed by the parliament, it is legal. So there are no rights above what the parliament says. It's the same in the UK, right, where there is no constitution. Effectively, whatever the House of Commons says goes. There is a European Human Rights Act, but it's largely been ignored. So I guess my point is, it is of some benefit that the US does have these explicit rights that are written down and are considered sacred and important by many, many people. So certainly through this crisis, I've kind of wished that Australia had some sort of Bill of Rights like that for the first time, because our parliaments have been able to get away with the craziest things, including invading people's homes to stop them sharing things on Facebook in Victoria if it was considered misinformation, dragging people out of cars at borders if they refuse to comply. That couldn't happen in the US, as I understand it. There'd be a lot of legal issues, but it can certainly happen in Australia and the UK.
And Canada too, yeah.
And in Canada, good point.
Yeah, I mean, I take your point. I think you're right. But I've been scarred a lot this past year.
It's all relative.
Another issue, which Jay touched upon, is that the vaccines have only been approved under an emergency use authorization. And the statute reads to require, sort of voluntary and informed consent of recipients, which sort of flies in the face of these types of mandates, in my opinion. But I would love to hear what the other panelists have to say about that.
I can jump in there. I think there is an inherent tension in here, the way that vaccines have been rolled out and presented to us. I mean, my own take, just coming from an economic perspective, is we want vaccines to be widely available. We want them to be, made present to those that are at highest risk, and we want the best information that we can provide given the circumstances before the public. But when you make that jump over into mandating something, you make that jump into requiring something by the force of law, it turns out to be, historically, it's a very slippery slope. One thing that I often harken back to and look at in some of the legal cases, and I know you as a lawyer can speak more to this, but in the early 20th century, some of the compulsory vaccination programs that came about were all very well-intentioned for the purpose of controlling public disease, but they pushed some of them too far. There's a very notorious Supreme Court case that came out in 1927 that used the vaccine precedents to justify racial eugenics and sterilization and all of these horrible policies that were also brought in under the mandate of public health. So it's really a legal balance here that has to be struck between making something available, encouraging people that are at risk to make use of that technology, and using that to combat the problems of the pandemic, problems of public health in general, but also the specter of government overreach is definitely there. We've seen it historically, and I think the risk is very high that something could go in that direction again in the wake of the events of the last year and a half.
Jacob, you're on mute, Jay.
Oh, sorry. Yeah, can I jump in on the EUA issue? Yeah, there's someone cutting the lawn outside my house. So on the EUA issue, one thing I've seen, and I'd love feedback from you guys because I don't know the legal aspects of this, but I've been told about this, and I wonder if it's right. So, in order to get an EUA, and I completely approve of having the ability to have an EUA, you should absolutely have some regulatory leeway when you have an emergency like this for developing therapeutics and vaccines and whatnot. I think that's a really good thing. But one thing I've heard is that when you have an EUA process, that if there's an effective treatment, for instance, then it makes it harder to get an EUA for a vaccine or something. So that the argument I've heard is that one reason why we haven't had quite the same effort in developing therapeutics is that the people are waiting for the EUA for the vaccine. The FDA was wanting to give an EUA for the vaccine, and if some therapeutic had been approved, it would have made it harder to get an EUA for the vaccine. And I wonder if that seems like an interesting, from a policy point of view, it doesn't make too much sense. Like, you kind of want to have a lot of leeway in the FDA to approve things that seem to work in the context of a health emergency like this. So I'd love I'd love to be corrected if I'm wrong about this.
It seems to me that the reason you would have that policy would be that, well, it's not such an emergency if you have an effective treatment, I guess. So it makes some sense to me, but there's really not a lot of case law surrounding EUAs. This is really a pretty new situation that we're in. Adam, did you want
to comment on the messaging of vaccines, which I think kind of the government messaging around them? It is rather strange that there is this push to make it mandatory. And we have seen, perhaps laudably, most authorities around the world extremely reluctant to, let me start again, warning certain age groups not to have the vaccine and suspending vaccines, whether famously the Johnson & Johnson one in the US, certainly the AstraZeneca in Australia. They have suddenly suspended them, which of course has scared lots of people, and many people think that the vaccines are dangerous when statistically they're not. So it's just a very, very odd dichotomy, if you like, where you have a push to make something mandated, but then at the same time you're kind of scaring people from having it. It's very strange.
There was a case called Jacobson from the Supreme Court in the early 1900s, where the Supreme Court said that a small town could fine people for not getting a measles vaccine. That's frequently cited in support of these kinds of mandates. In my opinion, that differs, because first of all, it's a one-time fine, as opposed to, we're sort of talking about people being shut out of society and not being able to participate in life in the same way. And then it seems to me that the disease is different. So the government interest is much stronger in a situation like measles, where it kills, I think, 30% of, that was smallpox. Jacobson is smallpox. But Jay, I know you had some thoughts about that.
I mean, so like the other vaccines, like just take the childhood vaccines. And again, I'm very far from a legal expert, so let me just stick to the medical issues on this. The childhood vaccines, if there's no herd immunity, and you give a child a diphtheria vaccine or a DPT vaccine or MMR vaccine, you are benefiting that child, because mumps is deadly for children. Measles is deadly for children. Rubella is deadly for children. And you give something that benefits them directly. In the context of the COVID vaccine, it doesn't benefit children on net to give it to them. It's more harmful than good because the harm from COVID is so low in children, very, very low rates of death and severe outcomes. So it seems like from a public health and medical point of view, you can't use the same argument to mandate in the context of a COVID vaccine that you would in the context of even a smallpox vaccine. Smallpox deadly in children, smallpox deadly in everybody, right? So I think from a mandating point, like what's the ethical basis for mandating? The ethical basis for mandating is you want to protect the person, like maybe there's parents that don't understand that their children are really a deadly risk from measles or something, and you say, okay, well, the state has some interest in protecting the child over and above what the parent wants. The other thing you might think is that it protects other people by stopping the spread of measles in the population, right? I don't think you have either case to make in the context of mandating the vaccine for children. For older people, does a mandate help? Well, I mean, I think, I can understand someone who's 60, that says, look, I'd rather not take the risk of an immediate, it's just low risk, admittedly, of these side effects, but I'd rather not take the risk. I mean, it's from their point of view, it's a health intervention. What interest does the state have in mandating that they get protected from a risk that they have looked at and balanced and said, look, I'd rather take the risk of COVID than I mean, I'll as a doctor, if they're asking for my advice, I'd say take the vaccine. But as a government, do we say you have to take it to protect yourself? So I think the vaccine mandates in the COVID context need to be distinguished from the vaccine mandates in the context of MMR or DPT or other childhood vaccinations.
Bill, did you want to?
Yeah, on a related point, I think it's worth reiterating that the government rollout and messaging on the vaccine throughout this entire last several months has just been atrocious. I mean, I'm even of the opinion that had Fauci just shut his mouth back in November and December, we would have much higher vaccination rates in the United States today. Instead, it's all sorts of contradictory messaging. It's playing the political games. It's going on TV and saying something that directly contradicted what he said a week ago. Weirdly, and I've made this charge, I think Jay has as well, and others have observed it, that Fauci almost became the biggest anti-vaxxer advocate in America just through his conflicting messaging and the way that he presented things like risks on the Johnson & Johnson vaccine, the way that he pitch this to the public. And we have to remember this from a policy perspective, because you have something like vaccination that you want to encourage those that are at high risk, those that are in need of this protection, to go out and seek. And as the economist in me looks at something like this and says, well, this is a transactions cost issue. This is something where we should be aiming to make vaccines as accessible and widely available as possible to those who need them. And the whole approach of this top-down, centrally planned, command and control mandate mentality that's really taken hold in the federal government is antithetical to that. Some of you that have been vaccinated probably remember back in December and January, the sign-up process just to get on the list to fill out the vaccine. It was cumbersome. It made like the Obamacare website look like it was using Google by comparison. There were waiting lists, all sorts of atrocious barriers, and especially barriers to those that were at most at need for getting the vaccine. That in itself has ended up being much more of a suppressant of vaccination rates than fear about the vaccine that's come in the wake of some of these decisions. And if anything, I think if you were to have polled people in November, December about their willingness to get vaccinated and compare that to now, you'd probably see evidence of a decline in trust in government officials that are pushing this simply because of all the months and months of conflicted messaging, really type of a top-down approach to something that very much could have been done on a voluntary basis and had much greater efficacy and much greater spread in getting people to voluntarily take the step to get vaccinated.
I think that's a really important point, Phil. I completely agree. I mean, in a sense, the mandate itself undermines trust in public health, right? Like there's this like this like it's almost, I call it an American thing, but maybe it's broader than Adam would tell me. But it's like, if the government's like forcing me, well, then what's wrong with it, right? I mean, there's this like sense of like this perverse sort of like, why do you have to force it? Like, why not treat the public like adults and tell them, here are the risks, here are the benefits, here's what it'll do. And that is the best way to get people to vaccinate when it makes sense. Just give people the data.
No, it's a great point. And certainly in the past with smallpox and polio and these horrible diseases, you haven't had to make the vaccine mandatory because people will volunteer to get it. I mean, you'd be rushing to get the smallpox vaccine, right? I mean, because it's just such a devastating disease. So, so the mandate, if you like, really is for the 30% of most countries who, for some reason or another, don't want to take the vaccine. And actually, just on that point, I mean, I don't know, a year ago, experts were saying that herd immunity would be about 60-70% of the population. Well, that's actually, 60 or 70% are willing to have the vaccine. So then why bother forcing the other 30% if that is the threshold of herd immunity? And just briefly, one more point on the risk point, which Jay was talking about. Back home in Australia right now, lots of older Australians are being attacked by so-called health experts for not taking the AstraZeneca vaccine. And these experts say, well, COVID is far more deadly to you than the side effects of the vaccine. But of course, that's not the rational equation. The rational equation is, will you get COVID in the first place, multiplied by the risks from the disease itself? And when you make that calculation, the side effects side of things is a greater risk for many people because there is no COVID in Australia, basically. So why would you take it?
From a legal perspective, that's one thing I've been trying to think about is I can't, there's something different to me about forcing or coercing people into getting a vaccine for the benefit of other people when it doesn't necessarily, when a disease doesn't really pose a risk to them. And I think the Constitution has various, privacy rights read into it. We don't have a specific amendment that says you have a right to bodily integrity or privacy, but some of the amendments like the 4th, 14th, 9th Amendment have been read to the ones that courts have said gives the right to abortion and other sorts of things like that. In my opinion, would sort of provide for similar right to refuse the vaccine or to not have your other constitutional rights restricted because you didn't want to get the vaccine. One question that I've been getting a lot is whether we'll probably see mandates for children in the fall and what the implications of that would be to go to school. Jay, maybe a good one.
I think it's deeply, deeply unethical, right? I think for as I've said, my calculation is that the vaccine on net is probably not good for children. I mean, we're balancing a low risk of side effects that's more than zero against a very, very low risk of harm from COVID. And I say it's like negative on net. Maybe someone comes up and says mildly positive. In any case, it's almost no benefit to children. I think everybody agrees with that, to take the vaccine. Well, maybe the CDC director might disagree. I don't know. But I think, but she did the calculation wrong. I think in that context, essentially, you're just denying children the right to go to school. Why would you do that? It's much more harmful to them for the skips. I mean, why, a year and a half of skipped schooling for children in California, essentially, we're going to compound that with another year of missed school for kids whose parents say rationally that, look, my kids are not going to benefit from this. Why are you forcing them to take it? I think it's just a deeply unethical thing to do. We've already undermined trust in public education, I think, in this country with the policies that we've adopted, many of the states have adopted. And I think that will just further that problem.
I can jump in a little bit on the privacy issue that, Jenin mentioned that there are implicit rights to privacy that have been read into various aspects of the Constitution. But we also have a history here. I think back to something like the AIDS epidemic. And lo and behold, Fauci was at the middle of that. Some of the issues that emerged there was ostracizing of people that contracted HIV through, hemophiliacs that had blood transfusions. There were children that were kept out of schools because of an irrational fear that this disease would be spread by them to their classmates. And it actually had severe, almost horrific social effects that came about from misinformation and misassessing the risks that were associated with disease. But at the same time, there's a privacy component of that, that this used to be raised regularly by groups such as the ACLU, some of the traditional civil liberties organizations that have previously expressed concerns about past epidemics and pandemics of some of the policies that we're adopting today. And I look at this and I question these organizations. Have they forgotten what their principles are? Have they forgotten what they used to stand for? Because we do have recent experience in memory with things like HIV and AIDS of clear social ostracism being directed at people who were seen as carriers of the disease. And I see some of the same trends emerging around the discussion of vaccination, and including mandatory vaccination, especially among low-risk populations. So that's something we have to be constantly on the lookout for.
Well, that's exactly why NCLA is here.
Exactly.
Adam, did you want to speak to that? Sorry.
Just on the HIV point, I think it is very interesting to kind of reflect on how societies dealt with AIDS and HIV in the 1980s, and from my point of view, to see how crazy we have become since then, because we did not deal with that disease, notwithstanding the fear mongering, of course, that existed in the 1980s. It was a new disease; people were very scared. But if we had have dealt with that disease like we are dealing with COVID-19, then you would have been locking people up back in the 1980s. You would have been shutting down nightclubs. You would have been issuing passports, forcing people to reveal if they had HIV, because that's what we're doing now. Now, of course, the diseases are spread very differently, but nevertheless, the logic is the same. If you could save lives, which of course is the mantra, we all know the mantra, save lives, that's what justifies all of this that we're talking about. You could have used that exact same logic about saving lives back in the 1980s and taken extremely extreme approaches to people with HIV, but that did not happen. It seems that we had greater respect for individual rights in the 1980s than we do now. And as a society, that's a very sad development, I think.
So why did that happen?
Well, that is, the question of the century. I think I'm a very fearful society, very weak society. I think it's very worrying, actually.
Yeah.
Bill?
I mean, even going back to the 1980s, it could have been much worse. The ostracism could have been much worse than what we already saw. And there's an almost identical pattern. So, and lo and behold, Anthony Fauci's at the middle of it. In 1983, he published an article in the Journal of the American Medical Association that had all sorts of wild speculation in it about HIV being transmitted through household contact, through sitting next to people on a bus, things that we all know were unwarranted by the scientific evidence, both at the time and certainly today. And yet he put that out there in a very irresponsible way in a top medical journal. Well, what happened a couple of weeks later? There are newspaper op-eds saying the government must step in and shut down the nightclub, shut down the gay bars, prevent travel to Haiti, all sorts of these draconian restrictions that fortunately for the most part we did not take. But the impulse was there at the time, and some of the same public health officials that are pushing this alarmism today were front and center pushing it back in 1983. So it's really odd to look back at that, just as Adam said, and think that we were actually much more attuned to individual rights as a buffer against this type of an approach to public health in 1983 than we are today. It's really a retrograde slide that we've taken on our concern for civil liberties, and yet some of the same actors are there using the exact same arguments to push in the same direction.
Yeah, exactly. And the courts have been, extremely disappointing in my opinion. What should be obvious, especially when it came to lockdowns, business closures, even, deprivation of education for children. Some of the state constitutions provide for the right for children to be educated. And yet those things were overlooked. I find it really frightening. I don't think we can rely on the courts to protect us when it comes to any of this anymore, as long as public opinion is, the public is so hysterical about a disease. Did anyone else want to speak to that, or shall I move on? So one thing we sort of touched upon, but I guess I want to come back to it a little bit, was, are there circumstances in which vaccine passports or mandates might be warranted, and what would be the circumstances in which maybe you would have a different opinion?
Well, just as I was saying before, is if it was a very serious disease, kind of general lethality, something like smallpox, then I think there'd be a case for it. But as we discussed, you wouldn't really need a mandate if it was a very serious virus, because people would be rushing to get it, rushing to get the vaccine. So I don't know enough about the history of kind of mandatory vaccination in the 19th century to know how necessary the actual mandate was. But certainly in Australia, we mentioned measles and mumps and things before. I mean, vaccination rates amongst children are something like 97%, and it's not compulsory. But most parents, when they have their baby, they just tick the box that says vaccination, because why wouldn't you?
Yeah, exactly.
So that's achieved without compulsion. Anyway, that's all I have to say. I'll see what the other guys are saying.
Jay, are there circumstances in which you?
I guess I'm not I think to me, the key thing is not the deadliness, but the transmissibility and the effectiveness of the vaccine in stopping transmissibility, right? So you can imagine a situation where you have a vaccine, you have a disease that's very transmissible, and that there's a high risk group, kind of like COVID, but also that the vaccine, the high risk, and it is deadly for that high risk group. And you can imagine a situation where the vaccine needs to be, you need to have very, very high rates of immunity to reduce the spread of the disease to the high risk group, right? Again, kind of like COVID, but where the vaccine has to be really, really effective in stopping that spread, right? So that's the problem. Like here you have a disease where the vaccine doesn't stop the spread, especially against the variants. You don't have a situation where you have a situation where the high risk group is readily identifiable, and can take other precautions, including the vaccines themselves, to get them out of the high risk group. So you'd have to have two things. I think you'd have to have a few things: the high transmissibility, the vaccine stops the transmissibility, and the high risk group can't vaccinate themselves to be protected against the risk of the disease. I mean, at minimum, you need those three things before I would say, yeah, let's consider mandating, because the mandate there would say these high risk group can't protect themselves, and the vaccine, you need to have enough people take it to protect that high risk group. That is not the situation you have with COVID. The high risk group can take the vaccine and protect themselves. In that situation, why do you need to create this sort of, there's like in economics, there's this idea of a positive externality I generate by taking the vaccine. I take the vaccine, I protect you because I'm less likely to infect you, but the harm to you is so low of getting it if you're already vaccinated. So the welfare benefit from having that positive externality is so low that it doesn't offset the harm from the mandating the vaccine. All right, again, the public health harm from mandating the vaccine.
Phil, did you want to?
Well, I just say that, we've known since about February or March of 2020, the very outset of the pandemic, that there are high areas of vulnerability. Nursing homes in particular emerged as one of the first areas that we knew COVID took hold. If you remember back in early 2020, it was in Washington State. One of the first outbreaks was in a nursing home. And that certainly became more evident over the next several months as it spread. I might say that, a nursing home is a circumstance where you have people that are of high vulnerability. And of course, we've made vaccination widely available to nursing home residents. But yeah, maybe a nursing home staffer might have a different calculation in their own mind, or the employer that brings them in there about whether they should get vaccinated or not, as opposed to someone who's just working in a restaurant or just trying to attend a ball game at the stadium. So very specific to the circumstances, but we do know where those situations of high risk individuals tend to be clustered, and we've known that for a while. And I see vaccination as an important tool. Again, as Jay was saying at the outset of the discussion, an important tool in focused protection. So maybe locations like nursing homes, certain healthcare providers should be suitably considered as places where vaccination is something that most of the employees take upon themselves, as well as the residents of those facilities.
So far we've sort of focused on whether there's a compelling government interest in these sorts of programs, which I guess we've established unequivocally that there isn't. But I sort of want to switch gears a little bit and talk about the privacy aspect. So New York has a passport program where you upload proof of your vaccination or alternatively a negative COVID test in order to gain entry to various venues. And that raises privacy concerns in terms of you're sort of having to show establishments your medical status. There's also a question as to whether there might be some digital trail created of places you've entered. And then, there are others. For instance, I just heard GMU's policy is to require professors to employees to upload proof of their vaccination, and they get pay increases if they're willing to. Which it doesn't, I guess it doesn't have to be, it's not whether or not you got vaccinated, but just being willing to upload the proof is enough to get it. So, in my opinion, these entail other, privacy concerns apart from having to get the vaccination itself. So I wanted to talk a little bit about that and your thoughts. Go for it, Phil.
Yeah, well, I hear privacy consideration, information control, and government all in the same sentence. That's very oxymoronic. I think we've seen multiple evidence that the government is not the best curator of sensitive information. So I'd say even the risk there is much higher, not from malicious intent, but just through ineptitude, incompetence, bureaucracy, everything that we see administering any other program that we engage in. So I imagine something like this if, say, hypothetically, the U.S. government were to implement a vaccine passport that had heavy privacy considerations, or even as we're seeing somewhere like in New York State with Governor Cuomo who's attempting to do the same. So imagine that type of a program. And then your default assumption should be that the average person that's working at that type of a program, the average type of a approach that is taken to its administration is akin to what you experience when you go to the DMV to get your license renewed. This is classic types of government bureaucracy. It's not going to be a very user-friendly thing. It's going to be chock full of incompetence, mistakes, casual errors, things that just slip through the cracks. And that is a whole area of vulnerability for not only your own personal privacy, leaks of information, leaks of data, but it's also it's the type of a program that would be very burdensome, very poorly administered.
I've heard people say, what's the big deal? So it's like you're vaccinated or you're not. But do you foresee other information being able to come out through?
Can I talk about that?
Yeah, go for it.
I think that this is one of the reason why health privacy is important is because others, when they know about your health status, will treat you very, very differently. Yeah. And in this context, we know that's the case, right? If someone is not vaccinated, there's this social norm that's developing that you're effectively unclean. We created this sort of two caste system where one caste is clean and one caste is unclean. Even if they had COVID and are immune, that's not enough. You have to have the vaccine in order to prove that you're immune. That is very common with disease, right? With any disease. Like if you're a diabetic, you'll get treated differently. People know you're a diabetic if in ways that harm you. Health privacy is a fundamental right in some sense, and it's the reason behind, I think, why the HIPAA law was so popular. I don't know if it protects us here, but it's certainly, I think that's the impetus behind it, is that that we don't want to create situations where people can be discriminated against simply on the basis of what some health indicator that they happen to have. I think that's I don't want to live in a society like that, and I don't think most people don't. And even if their minds are fogged by COVID for the moment, I think we'll eventually wake up and say, look, yeah, I don't really need people to know what my what my doctor said to me in the last checkup, and I don't really need people to know what my vaccinations. I'll tell you, I'll be public. I've been vaccinated, so you can have that out there. But that I'm voluntarily violating my own health privacy. That's a different thing.
Yeah, just to add, I completely agree with everything that's been said, but a slight counterpoint, I guess, is that I think governments, well, at least in Australia, they already know whether you're vaccinated or not for various things. So they already have this information in many cases. So this would just be another bit of information. So I guess my privacy concerns, privacy in the sense of giving the information, I think aren't so important to me as the actual right not to have the vaccine in the first place. But that said, it is a slippery slope, and kind of all the things that have been said are right. We just got to hope that we wake up from the brain fog, as Jay said, and this discussion ends.
Another topic that's pretty hot these days is the natural immunity. Why isn't natural immunity being recognized? And it's coming up a lot with people who are trying to seek exemptions in universities for having to get the vaccine. Jay, I think since you're the medical expert, I'll start with you. Why aren't we recognizing it? Should we be recognizing it?
Jenin, I saw you on CNN, and you did a fantastic job at explaining to the world why we should. I think this is one of these things where the trials themselves of the vaccines, the people who ran the trials, they enrolled people who had COVID to check to see if it was safe to give the vaccine to them. But when they decided to check the efficacy, they removed that population from the analysis because they knew that the vaccines don't do anything regarding protecting against severe outcomes for the set of people who already had COVID. It just doesn't. Natural immunity is robust. Once you get COVID and recover from it, you are going to be protected against severe outcomes. You may get reinfected again. This is a coronavirus. It's not like you're protected for life in the same way that if you get measles, for instance, and recover. That it's not permanent, but it is, or chickenpox, right? But on the other hand, it's as far as severe outcomes from reinfections, it's exceedingly unlikely. It's at least as good as vaccine immunity, maybe better. So it is utterly irrational to ignore it. Now, I think part of the, and you asked me why, I think that's less of a medical question than a psychological question. I think part of it is this idea, is like this engineering idea. If I inject you with a vaccine, I know that you have this, and you're just telling me that you had COVID, or I can't detect antibodies, and antibodies eventually decline over time. You're still protected, but I can't tell for sure. I can't. I need a. It's like we put plastic wrap on on things that we buy just to make sure that no one's opened it. I mean, there's some psychology around why you need to be vaccinated even if you already had COVID.
Phil, do you want
to jump in there? And I think this is more to the psychology, or I'd even say the political psychology of it. We've just gone through a year of constant flip-flopping, contradictory messaging that's come out of public health authorities. And I use Fauci as an example because he's probably the most prominent, but this runs through the CDC, the NIH, all of the officials that put themselves forward a year and a half ago is listen to us and we'll guide you through the pandemic. They have flip-flopped and bounced all over the place about what natural immunity does. And they started out actually early on. You can find interviews from Fauci back in March, April, May of 2020, where he is recognizing that natural immunity is not only existent, but a likely important part of what's going to bring this pandemic to the end. As we know more famously, you fast forward several months later to a year later, he's raising far-fetched specters of reinfection and the variants, and claiming that for some reason that the natural immunity is not covered the same way that vaccines provide protection to people from all of these new specters that he's raising. So I see a lot of the political psychology here as really politicians and politically aligned bureaucrats trying to cover their own tracks, trying to cover their own mistakes in the early part of the pandemic. And unfortunately, the politicization has latched on to even a fair and open discussion of natural immunity. I think all of you probably remember the point, it was earlier in the pandemic, I think it was around last fall, when the WHO kind of surreptitiously edited its website about what herd immunity was. And they used the classical definition, which is natural immunity plus vaccinated immunity together achieve societal herd immunity. And then someone went in the middle of the night and then changed that out and took out the natural immunity component almost solely for political reasons. So unfortunately, I see this as just another case of the politics intruding upon scientific knowledge and trying to pigeonhole the scientific debate so that it only aligns with one specific narrative, and that narrative has not been very consistent from the beginning.
And that again goes back to the compelling government interest issue, because there really can't be a compelling government issue in forcing vaccinations upon people who have immunity already, even if there was one for people who didn't. Adam, do you want to?
Oh, just kind of reflecting in my own mind, how public health became so authoritarian and communist. Like, when did that happen? And maybe this is a question for Jay, because you know far more about the history of this than I do, but at what point did health bureaucrats, if you like, become so insistent that everyone do things, by law? It seems a fairly recent phenomenon.
mean, you remember the debate over soda taxes. I mean, I think public health has always had this sort of like maybe the word is authoritarian the right word, like this idea that like they know what's good for you. But there's also been balance with that within public health, much more wise, reasonable voices, where public health is a tool to give people good information about how to stay healthy, as opposed to forcing you to stay healthy. And I think public health always has had that tension. Because when actually, could we talk about censorship? And because I think that is a really.
I was going to talk about it with Naomi, but
okay. I mean, I think this is one of like actually Naomi's been a victim of this in a nasty way, which is really terrible. But I think it's related to your question, Adam. Like so public health has this. There's this norm in public health that there has to be unanimity in messaging, right? So smoking is bad for you. If I start saying smoking is good for you, well, I mean, I've violated that unanimity. I might undermine the message that public health reasonably telling people, look, if you smoke, you're gonna raise your risk of lung cancer. You're raising your risk of all kinds of terrible things. Smoking is bad for you. That's just a fact that public health legitimately should be giving, because there's this enormous scientific consensus around that. And they're not for that now. Are they forcing you to stop smoking? Well, that's a different question. But the unanimity of messaging in public health, that there's that sort of like sense of like you have to all say the same thing. You all have to same like think the same thing, right? In science, of course, there can't be unanimity. Science is especially when you have a new disease, you have this like sort of, there should be this robust debate where we're learning stuff all the time. The authoritarian bent of public health, I think, comes from this idea that there has to be unanimity in order for it to be effective. And the problem is that the moral basis for that is that there actually is scientific consensus. What's happened in COVID is that there isn't scientific consensus, and yet we've applied this idea that there has to be unanimity of messaging in public health, or else you're creating public danger. Ironically, I think that it actually has created this danger, because we have suppressed people and the ability of people to debate one another about these things that affect each and every person. We've talked about privacy, we talked about your health, we talked about our children, the things like the most important things to us, and we can't debate it, we can't speak about it. And when the science is still in flux around it, is how effective is natural immunity versus vaccine-mediated immunity? I mean, I have an opinion based on what I've read in the medical literature, but that's still a robust debate going on about the relative levels of the protection. How bad are the vaccine side effects? Well, there's a robust debate going on. Silencing voices around that is utterly immoral in the midst of a pandemic.
Go ahead. No, go ahead.
No, I mean, that's all I wanted to say. I mean, I wish there were more legal recourses around that. I mean, and I hope that there'll be some legal pushback. Places like Twitter, Facebook, Google. I mean, I got removed from YouTube. I had a public discussion with the Florida governor.
Right.
It was put on YouTube. I mean, I thought that it's good government to like show like governors talking with their experts about, and so that so the public can see what the basis of the information the governor is deciding on. Isn't that good? Isn't that good governance? I mean, instead it's removed from YouTube. So I think we have to rethink the norm. I thought free speech rights were like a fundamental American public religion, and yet that's been utterly, there's been blasphemy against that religion all over the place during this pandemic.
I was also going to mention Martin Kulldorff being removed from the vaccine working group panel, safety working group panel, for having dissenting opinion on the Johnson & Johnson.
He's only the top vaccine safety expert in the world. I mean, I don't know why you'd want to hear from him.
Absolutely. You jump in on the same aspect of that with both the censorship and the public debate. We've experienced all sorts of oddities with that. There's almost been a rise of a fact checker class among media types, among journalists, among people on Twitter. And, you look into some of the background of of this, the people that are appointing themselves to determine what kind of messaging is permitted or not, are not medical experts. They're not people with social science backgrounds or hard science backgrounds. It's often some person with like a bachelor's degree in journalism or literature that just happens to work for one of these organizations, and they're taking it upon themselves to arbitrate and make decisions on what is permitted and non-permitted medical advice. I think that's a really horrifying trend, even though it's coming under the guise of private companies and journalism. It's, as Jay said, it's really against an ethos of free speech and open debate that we've long cherished, not only as a rule of law matter, but as a principle of a free and open society. So I think back to the classical values. I mean, it was John Milton in the 1600s announced, "Let truth and error collide," and I've never seen truth to be the worse for it. We need to have the open debate to tease out what the truth is, because otherwise it's never contested. And now we have people that are stepping into unresolved questions and periods of high information and uncertainty that do not have the background to arbitrate those positions themselves, and yet are making judgments. And that's where you get to the situation where top immunologists, top vaccine experts, medical doctors, government officials that are trying to have a free and open hearing are now censored because some mid-tier employee at YouTube or Twitter or one of these companies has taken it upon themselves to be the self-appointed enforcer of what the appropriate message is supposed to be.
And it's tricky because these companies have sort of replaced the public square. So there's not really a good legal framework for challenging it, because you don't have a First Amendment right necessarily to speak on Twitter, but these tech companies are controlling the discourse. So I don't know exactly what you do about that, but I think Adam has some thoughts.
Oh, I was just going to add an anecdote. In Australia, our top immunologist, Robert Clancy, was reprimanded by his own university for writing a paper, a very serious paper about ivermectin, and that just goes to show that another example of the insanity. But I wanted to stress Phil's point about so-called experts in the health bureaucracy. I mean, quite often these people are not really experts at all. They're just bureaucrats. They've done generalist degrees. Quite often failed doctors, I would say. They're not real doctors. These so-called chief medical officers. They've just reached the top of the bureaucracy, and they have skills to do that, but they don't necessarily have any other sorts of skills. So the idea that they should be shutting down senior professors, senior academics, from the world's top universities is just truly shocking.
I think we only have a few minutes left. So, and Jay, I know you have to leave in a second. So if you want to have any final words for us, or.
I mean, I really appreciate the opportunity to talk with you with Adam and Phil about this. I wish Naomi could have joined us, because I'd love to hear what her thoughts on censorship and lots of other things. I mean, I think I hope that we come out of this having learned our lessons. The main lesson to learn is how do we make this? I don't mean an epidemic, because epidemics are happening, but how do we make our response to the epidemic consistent with our values, our public values, democracy, with free speech rights, with autonomy, privacy. All of those are important values that should be at the top of our minds when we're dealing with epidemic. And we should never again throw those aside just because we fear a disease, even a deadly disease.
Thank you so much, Jay.
Thank you.
All right. Well, we can go to the Q&A portion of our panel, and hopefully the rest of the guests will stick around, and we'll take the questions to the audience. Any of the folks here have any questions?
What about the government's interest in, I'm thinking of smallpox and polio, they're almost extinct. Yeah. And one reason they are almost extinct is because the pool of people in which they can mutate is done. So does the government have an interest in making sure that the hosts in which that the virus can develop and mutate into maybe a worse virus are eliminated? And is that a public policy reason for vaccination?
Sounds like a question for Jay. But Phil, why don't you go? All right, both of you.
Yeah, I can.
enough about
I think there are definitely elements of public health. I mean, it is a thing. It is there are sound reasons for public policy measures to be taken to ensure steps are done to prevent the spread of disease. And I only caught the first part of the question there, but I think the question was like harkening back to like something like smallpox. It was a extremely deadly, extremely virulent spread that comes from the way that this disease operates. And back in the 19th century, public health measures very aggressively were taken to combat smallpox. I'm not at all opposed to those measures. What I would say as a caveat, though, is that many times even the public health bureaucracy operates with a hubris that they think they know the answer when they really don't. And the most famous example of this was the case of John Snow, the epidemiologist in Great Britain, who in the 1850s offered an alternative theory of what was spreading cholera. And this happened in the middle of a cholera outbreak in London. What was going on is all the public health authorities, and I've read the transcripts of the debates in Parliament about this, how do we stop this disease? And all the public health authorities were concerned with dispersing what they called miasma, or bad air that had moved into the area. So they hired teams of public health officials that went around and basically smelled out refuse, smelled out where the garbage dumps and the sewer dumps were. And they said whenever they found refuse, they had to mitigate it, so it got dumped into the Thames River. They didn't realize at the time that dumping it into the Thames River wasn't all that great when your water source for the city was being pumped out downstream, and it just spread cholera everywhere. But what Dr. Snow did is he said, wait a minute, maybe this isn't the real reason for the disease. I think this is actually a bacteria that may be contaminating the water supply. So he found one of the outbreak areas and shut off the water pump, and suddenly cholera went away in the neighborhood that was drawing from that water pump, just through the natural experiment that he set up here. And we tell the story as like a success of science, but the history here, the forgotten part of the history here, is that Snow was vilified by the medical establishment, by the Board of Health. He was denounced in several top journals and said, no, you're wrong. You're undermining public health by offering this alternative theory. And it took over a decade for his theory, which turned out to be proven right, to enter into the scientific literature. It was another cholera epidemic about a decade later in Great Britain, and they decided to repeat the experiment, and it was like, oh my God, Dr. Snow was right. So I think the lesson that we take from here is that when you have public health officials that are operating with hubris, especially around an unknown virus or something that we don't have good information on, the propensity for error, for a mistake, is very, very high and very consequential. We saw that in the 1850s in London. I'd argued we've seen it again with the lockdowns that we experienced over the last year. There was a rush to put scientific authority behind the efficacy of lockdowns, and they turned out not to work. And not only did they not work, they caused all sorts of horrific societal repercussions that are going to probably be felt for decades to come, that were just not thought of at the time. And as a result of that, it's almost as if the public health authorities asserted a valid presence to intervene against the pandemic, but did so with bad information, and now we're stuck with the consequences of bad information. So there's the risk there.
Yeah, they said, you know nothing, Jon Snow.
Okay.
Well, Sam from Ohio says that there's a judge in Columbus who required as a condition of probation of about 20 defendants that they get the vaccine in order to qualify for probation. And Sam wants to know, first of all, is that legal? And what can be done about that?
I would have to think about that a little bit more, but off the cuff, I would say that does not seem legal to make going on probation contingent on getting a vaccine. It seems like it should be a completely independent inquiry. Do you guys have
No, I don't think you're the lawyer. Yeah.
Okay, Jennifer Mayo has asked, what should parents do who are facing schools that are forcing them to vaccinate their children? Given everything the panel has talked about, what are there things that parents can do? Should they be armed with information? Should they be Should they contact anyone? Should they file lawsuits? What should they do?
They should file lawsuits. And in my opinion, the EUA, as long as the vaccines are only authorized under an emergency use authorization, that's probably the strongest argument. I don't know how long it looks. I've heard that the Pfizer might be approved in August or September, so that argument might not last, but I don't know that it will be fully approved for children. So that argument can probably be used for quite some time and should be used. Jared?
Yeah, you mentioned that there was a tension between the EUA and how it's approved for voluntary use and mandated vaccine passports. Could you just expand on that?
Yeah, so the EUA doesn't explicitly say you can't mandate vaccines, but the language makes quite clear that it requires the free and informed consent of recipients. So you're really not supposed to feel coerced, and it's supposed to be made clear to you that there are alternatives to receiving this, that it hasn't been fully approved. When governments are coercing people into getting vaccines in order to participate in life or go to school or go to university, that is quite in conflict with that statute, in my opinion.
Oh, that question.
Jenin, this question might be for you, but we also are aware of examples where United States citizens have traveled abroad and have been told that they can't come back to the country unless they have a negative COVID test. Do you have any thoughts on the legality of that sort of requirement and whether that violates any constitutional rights?
That one is a little trickier to me. I'd have to put some thought into it. It would seem that you have a right to go back to your own country that isn't contingent on, sorry, did you say vaccination or test status?
Testing, so it is a little bit different, but.
Do they allow vaccination as an alternative or not?
I think that the way that the program works is you have to show proof. It's a little bit similar to the vaccination passport. You have to show proof that you had the test and that it's been negative and that it's been within the last 72 hours or something along those lines. I think that you can't show that you had COVID 6 months ago and therefore you're carrying antibody. That's not good enough. You have to show you actually have had a negative test. So it does intersect with what you've been talking about in that way.
Yeah, I mean, you have a right to go back to the country to which you're a citizen, so it seems to burden that.
Australia.
That's true.
Yeah, except for Australia.
Yeah, it's true.
I think there was I think there was a court case, I guess maybe somewhat related to this. I don't know the details of it too much, but back when the Ebola outbreaks were happening in the early 2010s, there were several American missionaries that were exposed to Ebola in Africa and were transported back to the United States for treatment. And I believe the courts came down in favor of that because they were citizens, they had to be admitted into the United States because I think it was there were some concerns in the local communities where they were being housed. Oh no, you're bringing an Ebola patient into Atlanta or Dallas, but actually the courts were in favor of that. This is their right as citizens to return to the country, not only not having a test, but actually being carriers or potential carriers of a far more deadly disease than COVID.
Just to briefly finish my point, there are 30,000 Australians overseas who cannot get home regardless of what their test is or whatever they do. They're just restricted from even going home to their own country. Just extraordinary stuff.
Yeah.
That'd be North Korea and Australia. It's true. The only two countries where the government completely controls the border. And it's just frightening, actually, what's been happening back in Australia. But yeah, that's just an insight in what can happen when hysteria takes hold, which is certainly what's happened back in my country.
These are folks who have tested positive for COVID, or what are they excluded?
So the border is shut in general, so you just can't go to Australia. But there are limited exceptions. So about 5,000 people a week can arrive in the country. And if you're over the cap, you can't get home. So effectively they can't get home.
Didn't your friends say that once like 80% of people are vaccinated, they'll let, there was some...
5% of people are vaccinated in Australia.
Why are they doing so badly?
Well, because people don't want the vaccine because there's no COVID. So it's kind of this catch.
Wow, that's,
so it's, I I think they need an outbreak. And then
Well, they've been having plenty of
well,
Getting outbreaks even though their borders are closed. I'm shocked.
So great question from the chat. I feel for this attendee. They're anonymous. They said, but why are we simply deferring to the Constitution? Marbury versus Madison. Secondary, any law that's in violation of the Constitution is null and void. Why are these laws being enforced?
Well, unfortunately, the Constitution has, been interpreted over a couple centuries to fit things that it wasn't really designed, in my opinion, wasn't really designed to address in the first place. I don't think anyone foresaw something like this. And frankly, it's my opinion that the way that these cases from lockdowns to mask mandates to now vaccine passports are being dealt with are not really true to the principles of the Constitution. I don't think they should be permitted. So I don't think that the courts are doing what they're supposed to. I think they're caving into public hysteria or public pressure. And I don't really know what we do about that.
Brian Tucker just chimed in that, do we think that this is all just a government part of a larger plan to social engineer us and nudge us into accepting more control over our daily lives by the government? And if we do think that's what's going on, is NCLA going to do anything about it? Are there any plans? There are several people asking online if NCLA is going to get in this fight. I don't know if we can talk about that, but if we can, that would be a good time.
Well, NCLA has brought a few cases that are pertinent. My colleague Mike brought a case called DeRosers v. Baker, challenging lockdowns generally in Massachusetts, sadly unsuccessfully, which is another example of how the courts aren't really protecting us. We are looking into New York's vaccine passport program at the moment.
And his question about social control, maybe the panelists.
I'll give that one to Adam.
I think certainly the policies that have been pursued are so shockingly bad and do benefit powerful interests so much that it does look like, I must say, that there is some sort of conspiracy of interest to change the structure of Western civilization. But that said, I still don't personally subscribe to this idea. I think you could explain mostly what's going on through just sheer vested interests of individual interests of governments, bureaucracies, of pharmaceutical giants. I think it's a confluence of interests which kind of explains what is going on, rather than any sort of conspiracy.
Interests and incompetence.
Right. And I'd echo the exact same thing. Never attribute to conspiratorial design what can be better explained by self-interest or incompetence in many of the cases that we have here. One thing I keep reminding myself of, so Neil Ferguson, the famous modeler at Imperial College, who in many ways launched this panic back in March of 2020, he gave an interview, I think it was in December, where he was reflecting on what they had gotten away with. Basically, the interviewer asked him questions on like, did you ever think that you could pull off lockdowns for this long? And he said that his answer was initially no. When they saw it coming out of China, that China was using the lockdown strategy, he didn't think that was anything that would ever fly in Western democracies. And then around February 2020, the Italian government started to experiment with it. And like a light bulb went off in his head, and he explains this. He said, then we realized we could get away with it, and it's like the floodgates were unleashed. So I think you have people that are both making it up as they go, but that are also seizing on to some of the events that have happened very opportunistically and in ways that we would not have foreseen just over a year and a half ago. But unfortunately, it's like putting the genie back in the bottle, and that one is a very tricky mess that we have ahead of us. That's unfortunately also something that happens in crisis situations. So I liken this, COVID-19 has a political dynamic that's very similar to something like 9/11 or wars in the past, the Great Depression, other catastrophic events, because the rush is always to respond to them in bold and sweeping ways through policy mechanisms that are never really thought out all that well. And then you're left for years or even decades of trying to clean up the mess of the initial policy missteps.
Thank you so much, Phil. We were going to wrap it up. Thank
Thanks.
you. Thank you, everybody, for coming.